Hi everyone, my name is Lauren Niles. I am a registered nurse and today I'm going to be talking to you about otitis externa, or more commonly known as swimmer's ear. Otitis externa is an infection of the outer ear, and today we are going to talk about the symptoms, what causes it, how we treat it, and how to prevent it. Otitis externa is an infection of the soft tissue surrounding the ear, which can include the pinna or outer ear, tragus, and surrounding lymph nodes under the chin or the neck. Symptoms include inflammation of the ear canal, tenderness, swelling and/or redness of the ear canal, and in some cases, drainage from the ear canal and surrounding tissues. Swelling may also occur in the lymph nodes located under the ear and on the neck. Otitis externa can be caused by high humidity, heat, and moisture in the ear, which occurs frequently during the summer when many people participate in outdoor activities and water sports. Otitis externa is also commonly referred to as swimmer's ear and is commonly seen in the summer months in children between the ages of 5 and 14 years old with prolonged water exposure. Swimmer's ear is a very common cause of ear pain in both children and adults, with approximately 1 in every 123 people affected in the United States in 2007, according to the Centers for Disease Control. Within the ear, earwax creates a natural barrier to prevent infection from developing within the inner ear. When trauma occurs to the skin within the ear canal, the protective barrier created by the earwax is broken, which can lead to the development of an infection. Trauma can be caused by cotton swab use, earbuds, scratching the ears, or earplugs. The organisms that most often cause otitis externa are usually from the Staphylococcus family and are treated with antibiotic therapy. In 90% of cases, otitis externa affects one ear rather than both. Otitis externa is a self-limiting disease, meaning that most patients will begin to feel better with treatment and slowly return to normal activity levels in their own time. However, if left untreated, cellulitis or a serious infection of the neck and face may result. In very rare cases, the infection can spread to the skull and cause an infection of the bone, which is a life-threatening illness. The medication most commonly used to treat otitis externa is antibiotic ear drops. Some providers may prescribe an eardrop with a steroid to reduce inflammation, which has been found to reduce ear pain in many patients. If antibiotic drops alone are prescribed, gentamicin is most commonly used. If combination drops are prescribed, hydrocortisone with neomycin or ciprofloxacin is most commonly used. Medications are usually prescribed to be taken for 7 to 10 days, and patients should start to see an improvement in pain 48 to 72 hours after beginning antibiotic treatment. Parents should also monitor for a reduction in the amount of color of the ear drainage. For example, if drainage was previously green and is now clear, this indicates an improvement. But if drainage was clear and is now green and foul-smelling, parents should contact their healthcare provider. Now we will discuss how to apply eardrops. Eardrops in children should be applied by a responsible adult or parent. The medication bottle should be warmed in the hands prior to administration, especially if the medication is being kept in the refrigerator. Patients should lie on their side with the affected ear up or lean over to the side. The parent should apply the prescribed number of drops into the ear without touching the tip of the bottle to the skin. For adults and children over the age of 3, the top of the ear should be pulled up and back. In children under the age of 3, the ear should be pulled down and back to straighten the ear canal. After administration, the patient should remain on their side for up to 2 minutes if tolerated to ensure the medication does not drip out. As always, wash your hands before and after applying the medication. These medications are very safe, but some side effects are possible. A local reaction, including redness, itching, and swelling, can occur, and should be reported to a healthcare provider. A more serious infection may also develop when eardrops are used over long periods of time or not taken as prescribed. Taste may also be altered while taking the medication, along with dizziness, vertigo, and in some cases, a tingling sensation in the fingers and toes. If signs indicate that the infection has spread into the body, your healthcare provider will also prescribe oral antibiotics, which must be taken as prescribed until they are finished. Oral antibiotics may also cause some side effects, including vomiting, diarrhea, stomach upset, or rash. Allergic reactions and anaphylaxis to some antibiotics are also possible, and parents should watch for shortness of breath, hives, or swelling of the lips, face, or tongue, and contact a healthcare provider immediately if these symptoms occur. Many parents ask if there are ways to prevent swimmer's ear in their children and in themselves, and luckily, there are many simple ways to stay safe, happy, and healthy in the summer while participating in water sports. Keeping your ears as dry as possible by using a bathing cap or earplugs while swimming helps to keep water out of the ears. After swimming or showering, drying your ears thoroughly with a towel and tilting the head to the side to allow water to escape the ear canal is also helpful. Using a hair dryer on the lowest heat setting can also help to dry stubborn water within the ear canal. Make sure to only swim in clean bodies of water, such as a swimming pool where the pH has been tested. Also, you can talk to your healthcare provider about using alcohol-based eardrops after swimming if you frequently experience otitis externa. Thank you, and make sure to have a safe and happy summer.